Hello, my name is Jeff Stauffer, Community Relations Director with Elville and Associates, and welcome to our webinar today, the sixth in the Elville Webinar Series Wellness Series titled Keeping Your Brain Active and Healthy, presented by Ms. Ellen Platt of the Option Group and Dr. Michelle Fritsch of Retirement Wellness Strategies. So how this will work today, if you're new to our webinars, if you are, welcome. We're glad you're here. And if you're a frequent attendee, we're thankful as always for your support of our webinar series. So you as the attendee are in listen-only mode. However, if you have questions or comments, and we really want to encourage attendee participation during this webinar, please note them in the questions panel or chat box on the right-hand portion of your screen. We will also be unmuting all attendees so you can speak through your microphones at various times during the presentation to share your thoughts with Ellen and Michelle. This worked very, very well during Saturday's client care program presentation that Dr. Fritsch was on as well. So please give it a try and don't be shy. We want to hear your voice. You also received the presentation by email from me yesterday for your convenience to take notes on it if you wish. If for some reason you did not receive the presentation, it is currently in the section marked handouts in the panel on the right-hand portion of your screen to download at this time. Everyone will also receive a post-webinar feedback email right after the presentation, and we ask that you please take just a couple minutes to fill out this simple survey to offer us your feedback and thoughts about the presentation, and we read and value every comment that you have to share. Elville & Associates works every day with clients with the ideals of client education, collaboration, and compassion in mind. We're always available for consultations to discuss your family's planning needs and look forward to being a resource to you in any way, now or in the future. So at this time, as always, I'd like to welcome back and turn the webinar over to our presenters, Ms. Ellen Platt and Dr. Michelle Fritsch, who will share a little bit about themselves and get started with the presentation. So Michelle and Ellen, it's all yours.
Thank you, Jeff. Today we're going to be talking about keeping your brain active and healthy. As some of you have been doing this series with us, we've been talking about wellness and health and different ways to improve your quality of life. And so we're going to be talking about that as part of the wellness series. I'm Ellen Platt. I am an aging life care manager, and we work with families helping them navigate longevity, whatever that means. So we do get into times when we're trying to find ways to improve people's lives and let them be as independent functioning as well as they can through time. So happy to be here today, and I'm going to pass it over to Dr. Michelle.
Thank you. I'm Michelle Fritsch, and I found after about 25 years in healthcare that too many people enter retirement without a plan to stay healthy. So that's what Retirement Wellness Strategies is a process to dive deep into your current health status, risks for the future, minimize those, and make sure that you've got a fulfilling plan for time going forward. We're so excited to be here today, and we'll tell you later that during the pandemic, Ellen and I have worked together to create a version of what we both do with people one-on-one in a way that is more self-directed through a subscription program, and we call that Propel Comprehensive Wellness. So we'll be excited to share that with you later.
We're going to do a SMART goal check-in. If you guys were here in January, the new year, that's often a time where we're reflecting and figuring out what do we want to do for the new year? How do we take care of maybe some issues or things that we've been thinking about need a change? And how do we move forward with that? So one of the things, if you recall, or if you weren't here, we talked about SMART goals, S-M-A-R-T. SMART, the S stands for specific, M stands for measurable, A is attainable, R is relevant, and T is timely. And this is how we break down our goals for the year into smaller, manageable sizes and give us some direction on where to go. So I'd love for people who are here, or even people who are not here in January, to put into the chat feature which goal you've had the most success with so far this year. We can put that in, just throw in whatever you had. Maybe Jeff, you can share if anything comes in. Let us know where you had your biggest successes so far this year And what do you think it was that helped you stay on task?
Sure, I'll go ahead and share those. And I've also unmuted everybody. So if you want to share verbally, now's your time to do that.
Great. We'd love to hear those success stories.
And which ones you're still working on? Because sometimes we have big goals in January that sort of fall off by March. So we want to celebrate if you're still plugging away at your goals, which we hope you are.
These could be personal goals, professional goals. Do we have anything in the chat there?
Not yet, Ellen. We've got a quiet group so far.
Quiet group, okay. So we'll keep on going. If you can think about it, if you want to add it later, put it in, or even think about new goals. So maybe you found that a goal that you set in January maybe really wasn't that relevant. It wasn't something that you really wanted to pursue, or you've gotten to where you want to be and now you want to look at new goals. So SMART goals don't just have to be at the end of the year.
We do have one.
Oh, great.
And that's one I like to see, and that is starting an estate plan. I didn't pay that person to say it, but starting an estate plan is one, so that's always good.
Great. Very good.
I also have one. I've been exercising regularly now for almost 2 years after a 110, 12-pound weight loss. So I'm slender now at age 62, and I'm pretty fit. So
congratulations. What was it that kept you on track for so long? Huh? What was it that kept you on track for so long? What's your magic?
Well, honestly, I didn't exercise at first in the beginning because I felt like I was just too heavy. And then I got a Nordic track, you know, one of those ones with the trainers, iFit, and I loved it. I really loved it. And I started with the beginner programs, you know, walking, and then I went to hiking, and then I said, okay, I'm going to try running that I did a long time ago. And I started at the beginner level, and now I'm at intermediate. So I run 3 times a week, strength train 3 times a week, Pilates 3 times a week, and a flexibility course. Some of those classes are the running I do on my own and the strength training. The other ones are through Sage with the Prince George's for the seniors, which I would highly recommend to anybody because they, you know, so, and I'm always looking for opportunities to, I just went and jump rope for, you know, a minute or two just for the heck of it. So I'm always looking for opportunities, and as I get stronger, it keeps me motivated. I mean, it really does. And looking at pictures.
Going. That's awesome.
That is terrific.
I like how you've added so much variety, so it's not the same thing every day.
Right. Yeah.
I like how you started out at the beginner level, and then you challenged yourself to progress as you were finding those small successes. And you really made it very measurable. 3 days a week, 2 hours a day, and using certain programs that were prescribed for you. So it's very measurable, and it really kept you on track. Congratulations.
Yeah.
Thank you for sharing.
Continuing to set goals, so.
Good.
Yeah. So last month in February, we talked about purpose and how it greatly impacts our health and our wellness. And we want to include, when we're talking about purpose and wellness and health, we want to talk about the different spheres in our life: social, spiritual, psychological, biological wellness. And so I'm wondering if anybody was able to reflect a little bit more since our last webinar about their purpose, and if they discovered anything about themselves that they'd like to share. So if you discovered something or found something that kind of excites you, kind of floats your boat, and you want to share it, please do. We'd love to hear some ideas. While we're waiting, go ahead. Go ahead, Michelle.
I was just going to say, I'll share that I have somebody in my life who discovered a that they really like fixing clocks. And so they have a fun time going to flea markets and antique stores, finding clocks that could have value, but they're just broken, and then fixing those. And so it's not really related to what was his profession all those years, but it really, between the shopping and then the fixing and then finding people that might want those clocks, it's been a fulfilling new thing to do.
That's great. While we're waiting for people to share, I'd like everybody to think about 3 things that you might like to try if you had the time. Just think about what they might be. Come up with 3 things that you might try if you had the time. So hopefully we've
Tell me
got
where the chat is. I can't find the chat.
Should be at the bottom.
So I believe the chat should be at the bottom. It should say chat, or there's a question panel where you can also, if you click on the where it says questions, you can click on that and type in. It'd be the same thing as the chat feature.
I know in my view, there's this orange arrow that expands that window so you can see the chat. So yours might be closed. Maybe click on the orange window so you can see it, or the orange arrow.
All right, so there's 3 things. Hopefully you've thought of 3 things you'd like to do if you have the time. And I'd love for everybody to think about whether they have that activity on their calendar scheduled sometime in the next month. And if not, consider which one you might put on your calendar. A lot of times we think about it, but we never take that next step to actually do it. So if there's something, even if it's something small, even if you're not sure if that's what you want to do in a bigger way, it's great to just try it out, have an open mind and try something new. Not only does that possibly give you an avenue to figuring out what that next big thing is, because you might run into scenarios or people that become an important part of your new purpose, but it's also a way to maintain our brain health. And that's what we're going to be talking about today. By trying something new, trying something novel, that is a great way to maintain cognition and slow the rate of decline. So if you have those 3 things, make a little note next to you. And after the webinar, see if you can get one of them at least scheduled on your calendar in the next month.
One other reason to do that, I was just reading a great article about the rising divorce rate in people over 50 and tips to turn that around. And one of them was, think of something you've never done before as a couple and go experience that. So be adventurous and try something completely new. So that kind of fits all those things you're talking about, Ellen, plus maybe put a little spark back in things.
We have somebody here that said, I've been taking piano.
Great.
There's a lot of good memory benefit from that, for sure.
Yes, great. Well, as we navigate this maze called life, we may find there's so many options, and sometimes it might be kind of overwhelming. So like we mentioned, like starting small or having an open mind to try something new, it may funnel you into something that you hadn't even thought about. So I encourage you to just reflect on that, explore different things. If you try it a couple of times and don't like it, try something new. But that's a great way that's going to lead to brain health, maintaining cognition, and ultimately longevity.
Absolutely. How many times have you walked into a room and completely forgot why you were there? I did it yesterday. And how many times have you laid something down and forgot where it was, or struggled to think of a word that was on the tip of your tongue? I find a lot of times when those things happen, we start questioning ourselves and, oof, is this it? Is this the sign that my memory is going? So can anyone relate to that? Any stories you want to tell? Anybody want to laugh at themselves?
Well, I have to share the story. I'm going to tell them myself, Michelle. When we were preparing for this webinar last week, I said, do you remember what the topic was? And we both had a real giggle when we realized it was about brain health.
And memory, yes. Yes, that was very good. All right, so when you feel that when those things happen, and they happen once in a while, that is not unusual, especially with all the stress that we've been through as a globe during the pandemic and now the war in Ukraine. That wears on you. It certainly distracts your brain in a number of ways, and we could talk more about that in a few slides. But even if you feel like, oh, it's happening more, it's not just a once in a while thing, then we encourage you to start by telling your doctor, because they can double check. If your heart is not pumping efficiently and getting blood everywhere, including to your brain, that can result in not so sharp thinking, kind of fuzzy thinking, maybe sporadically feeling like you're more forgetful than others. So they can look at your heart, figure out if it's a heart function problem, and usually remedy that. Same with your lungs. If something has happened and you're just not able to get good oxygen into your lungs through your breathing, then that impacts the amount of oxygen that gets to your brain and can again impact the clarity of your thinking. And our thyroid can cause problems at any age. And so typically at your annual physical, when the blood is drawn, your thyroid is checked. But maybe double check with your doctor and make sure that your thyroid has been checked, or maybe they'll check it again. So those are 3 physical things that can be identified, fixed, and help you regain your clarity of thought. The other ones are they can run some more blood work and determine is your vitamin B12 level where it should be, or vitamin D. We've got electrolytes, including potassium and sodium, that when those get out of whack, which usually is going to be caused by a medication, those can be remedied. And then your blood sugar. So if you have diabetes, if your sugar goes too low or too high, that can impact the clarity of your thinking. So again, you've gone back to your primary care doctor, said, I feel like something's changed with my memory. They can do some physical tests as well as some lab tests to see if it's something that can be fixed. Another one is the impact of your mental health. Depression and dementia can look very similar. And not to put you on the spot, Ellen, but I bet you've seen this happen with some of your clients.
Yeah, definitely. Depression can really impact, as well as stress and anxiety. All of those can really impact your ability to process. So a lot of times we start escalating, and we're processing things down in what we call the lizard brain, in our prehistoric brain that was invented for survival. And you have the ability or the feeling that you want to either fight or you want to flee, because that's what we did back in the caveman days. So we're not living in those times, but yet our body is geared to react that way because of survival. So what we need to do is learn how to manage those other things, manage the depression, manage the anxiety, manage the stress, with a lot of the techniques that we've used in the past and some that we'll share today. But that is what's going to help you think from the upper part of our brain that is processing and is critically thinking and creatively thinking of ways to solve the issues.
Michelle and
Absolutely.
Ellen, Going back just a few seconds regarding the thyroid, a question: do people who have had their thyroid removed have a greater chance of developing memory loss?
I don't know that it would be related to the removal of the thyroid as much as it would be related to keeping those thyroid levels through the use of the supplements like the levothyroxine, keeping those where they need to be. And so making sure you're going to those follow-up appointments, having those levels checked so that any dosing adjustments that are necessary can be made.
Thank you.
You're welcome. That medication comes in so many different doses, and the reason is that it allows for fine tweaking of the dose, and there's a reason for that. We all kind of fluctuate a little bit, even if you're solely getting your thyroid function from your supplement. So that frequent monitoring is absolutely key so that those little adjustments can be made and keep you in the zone where you're getting the maximum benefit. Speaking of that, medications can have such a big impact on clear thinking. And someday, if we've got time, I'd love to tell you story after story where someone was convinced that dementia had set in, they couldn't be autonomous anymore, they were going to have to move into a place that could provide them with support. And we tweaked medicines and they got their clear thinking right back. Just story after story after story. So long before you think you have dementia or you even go to be diagnosed for any mental impairment, we've got to start by clearing up your medication regimen. So the first one, going back to what will help, if there's not good heart function or blood flow or oxygen from your lungs, or your thyroid's off, or you have depression, there are medications that can help optimize those things, get rid of the problem and make those better. So we start with that. And then so many different medicines that can make you think less clearly. So I'm just going to give a few examples, but I have to give the disclaimer. Please don't change anything in your regimen based on this list. Just use it as a guide for questions that you can take to your doctor and discuss whether these things could be altered to help clarify, give you better brain clarity. But please don't change anything on your own. Medicines that impact the brain in particular usually need to be carefully titrated up, like the dose gradually ratcheted up to get to the right benefit of the medicine. And then they should never be stopped cold turkey. They've got to be carefully titrated back down, because by impacting their brain, they're impacting the transmitters, the messengers in the brain, and the brain does not change on a dime. It needs gradual adjustment. So even if you see something on my list that makes you think, ooh, I take something like that, please don't change it. Get some guidance first. I do a lot of working with healthcare teams to figure out how to very carefully tease medications away or lower doses. So work with your doctor, work with your pharmacist to make sure you do that at the correct rate. So some of the things on my list: pretty much every medicine that is used for anxiety or nerves, especially the benzodiazepines. So if you've ever been on or know somebody or you've heard of these medicines, diazepam, the brand name is Valium; alprazolam, the brand name is Xanax; or lorazepam, the brand name is Ativan; or oxazepam, any of those PAMs. Those medicines definitely, by calming you, by relaxing you, by helping you sleep, they definitely severely impact the clarity of thinking. Depression medicines, especially the older ones, but even the newer ones, because of what we talked about where doses need to be carefully increased and decreased, those medicines, we need to make sure that you're on the right dose, and that if you're going to switch or go off of that medicine, that it's done at the appropriate rate. This is not surprising, but all sleep medicines are going to impact the clarity of your thinking because they are working to put you to sleep. And I want you to be careful because that means they can really impact your risk of falls. Pain medicines, all of them, especially the opioids or narcotics, those medicines, they help with the pain, but they also decrease the clarity and sharpness of your thinking. Seizure medicines and nerve pain medicines, so like Neurontin or gabapentin or Lyrica, pregabalin, commonly used for like sciatica pain or stiffness. Those medicines can definitely, they may help with the pain, but they definitely decrease the sharpness of your thinking. And I should add here any sort of muscle relaxant. Huge impact on the clarity of your thinking. So then think of dryness. So I have a picture for you. I used to live here, but that's the desert and it's really dry. Medicines that anything that's wet and you take a medicine to dry it up, not only will it have that drying effect, it will also decrease the clarity of your thinking. So that's anything like a medicine you take for incontinence or Parkinson's, certain, not all, certain Parkinson's medicines. And when you've got a cold, you know, you've got a runny nose, you're producing a lot of mucus, anything you take for that has that drying effect. Antispasmodics, if you've got stomach or intestinal spasms that you might be given, diarrhea, muscle relaxants, I mentioned, nausea or vomiting medicines, antipsychotics, or things you might take for motion sickness. They can be effective when you need them. They can be very effective, but know that they're all going to just decrease the clarity of your thinking. So if you're taking one of those and you're like, oh my goodness, my memory is going, or I just can't make good decisions, or I can't seem to focus, it's the medication. And again, numerous stories of just gradually teasing some of these medications away or lowering the doses, working with the healthcare team. We've had great success with people going from feeling like their memory's going to feeling that sharp thinking again. So I'm going to stop there for a second. Again, I don't want anyone to feel alarmed. If any of this describes your medications, just go talk to your doctor and your pharmacist about it. But have any questions come in, Jeff?
Yes, we have one, Michelle. How about Fycompa, Fycompa? It's a seizure medication. Do you have any comments about that?
Any seizure medicine, because of what they do, has the risk of potentially doing this, but certainly the benefit of preventing seizures is greater than the risk. You just want to make sure that your healthcare team's aware. If you feel like it's really impacting the clarity of your thinking, let them know. Sometimes just a minor dose adjustment can help with that. Or if it's really bad, switching to a different seizure medicine, but never ever change those without working with the team, kind of clarifying what are your goals and making sure that they can still manage those seizures. That is a tricky area because there's nowhere to have an anti-seizure medicine that doesn't have some impact on the clarity of thinking because it's all about the electrical signaling in your brain.
And another question, it doesn't specify the specific medicine, but do these medicines have long-term effects on memory?
Not usually. That's one of the beauties of it. If you are having the side effect of a medicine that's changing the clarity of your thinking, and that can be tweaked, then the clarity comes right back. So that is very good news. Great questions too. And I have to talk about sleep medicines, but in particular, a whole lot of these sleep medicines, the thing that makes you sleepy is diphenhydramine, which is the main ingredient in Benadryl. It definitely makes you sleepy. It is, the last I saw the data, the #1 culprit for middle of the night falls because it so impairs your ability to really be alert and thinking as you get out of bed to go to the bathroom or something. It impairs that so badly that not only is it a big risk of falls, but a risk of the serious falls, the hip breaking kind of, or the head bashing kind of falls. So I highly discourage the use of any over-the-counter sleep medicine. And if you ever want to talk about that further, we could, but I just can't say enough about discouraging the use of over-the-counter sleep. they all have pretty much the same kind of ingredient. So Ellen mentioned this, and I just had some pictures to kind of reiterate it because it's so important. If you look at the yellow part of the brain, which is the kind of the top and the front of the brain, that is the part of the brain where we are creative, smart, able to memorize things and really think things through and make good decisions. It is the part of the brain that can problem solve. But there's another part, and Ellen called it the lizard brain. I call it the walnut. If you look at the little brown dot toward the bottom, not sure if you can see my cursor, but underneath that red thing, this brown dot. And look, it's so tiny in comparison to the whole brain. But that is the part that is intended to only function when you're being chased by a bear. Something terrible is about to happen and you need to escape to survive. And I always think of Little House on the Prairie, where Laura Ingalls Wilder is running through the meadow, carefree in the world. When we're relaxed like that, then we're fully operating in this frontal part of the brain. But as soon as we're in danger, that amygdala, that walnut or lizard brain takes over, and its purpose is to tell you, oh my goodness, we're in danger. Send all the blood flow to your muscles so that you can, your heart beats faster and stronger so that you've got the energy you need to run away. Unfortunately, in our society, and since the beginning of the pandemic, it has gotten so much worse. Many of us spend most of our time in that panic mode, way more than we spend time up here. I've had so many people make comments about, I used to be creative, and as my aunt says, I don't have a creative bone left in my body. Well, it's still there. Or I used to be able to learn things or figure things out or make good decisions, and I can't even think about it now. Well, those are all signs that stress is driving your decisions, and that amygdala has taken the driver's seat. So one of the best things you can do to make sure that you're using your best brain is you can take back control. And that's what we'll be talking about, some more strategies, and we've gone through several strategies the last several months, where if you can just calm yourself, focus yourself, you can take the control away from the amygdala and put it back in this part of your brain that makes good choices. So before we practice one of those, are there any questions or comments, or does that make sense?
When you talked about the sleep medicine, you weren't referring to melatonin, were you?
You know what? That slide used to say that melatonin is safer and I would recommend it. But we're learning that even melatonin, nothing is like completely without side effects. So if you're going to use melatonin, make sure you talk to your doctor about it and make sure it's going to be safe with everything else. And if you're going to try it, I'd start at about 2 milligrams. For a while, people were jumping straight in with 10 milligrams, and they were the ones that were having some trouble. That's a very good question, because I know my mind has changed on that recently.
It doesn't do a thing for me anyway.
And if you're going to try it, you got to give it a month, because it doesn't make you sleepy like the other ones do. What it does is increases your melanin, and that takes about 30 days to change. And if you're short on melanin, then it will bring you up to a normal level, which will increase your ability to relax. But if that's not your issue, your melanin is fine, then you're right, it's not going to do anything.
I have one question here. Is there any medicine that makes us prone to loss of memory in the long term?
It's a great question. I'm thinking through all the medicines. It wouldn't be very many. Most medications, once we can remove them from the system, that clarity can come back. Now, certainly there are going to be some exceptions and medications that can cause some long-term toxicity effects, but nothing's even coming to mind. It would be something rare and probably a medication that we use just on rare occasions, like maybe some of the more severe chemotherapy type agents.
And other comments. This refocusing reminds me to wait 24 hours to respond to a heated work email.
1,000 times, yes.
Very
I
true.
know I've gotten in trouble. Yes. So Ellen, you want to guide us through some
Sure.
strategies to leave the lizard brain behind?
Yep. So there's a lot of things that we can do to kind of just calm ourselves, and obviously just being still, removing yourself from maybe a chaotic environment. If you have the ability to go into a quiet room, maybe turn out the lights, just have it a little bit dimmer, and just get that environment so it's quiet and calming and soothing. And there's lots of things you can do, like gentle stretching. You could get some lavender is often an herb that's used to calm and relax. So lavender lotion, using your hand, rubbing your hands, maybe your neck, tilting your neck from side to side, and just kind of deep breathing. And we've done some breathing exercises, whether it's breathing in for 4, hold for 4, breathe out for 4, and hold for 4. That's called box breathing, where you just do in, hold, out, hold for the count of 4, and just keep doing that. But really it is, as you're breathing in, think of it as some type of nutrition, or you're being fortified as you're breathing in, and then you're breathing out. Get rid of the stuff that no longer serves you. Get rid of the stress and just visualize that leaving your body with your breath. Some of the things that we can do and that we can take control of, because a lot of times our stress and anxiety comes from things that we're not able to control. The things we can get some control of is our exercise, our sleep, carving out time for sleep, carving out time for nutrition, and making it things not just the drive-through, but actually things that really are good for your body. Shifting your focus from the things that are stressing you out to some, maybe a visualization of going to your favorite spot at the beach or a walk in the park or something like that. Again, controlling the situation that you're in, maybe visualizing a situation you'd like to be in. But other things to kind of help us is connecting socially. This is also good for our brain health, but also good for decreasing stress. Having somebody that you can confide in or share with or do something fun with. And it may be friends, it may be family, it may also be a professional person who can help you sort through issues or situations or circumstances. Having somebody that you can talk to and kind of process issues with. Staying socially involved, engaged with other people also helps you, again, maintain cognition. So those are things we want to do. Those are things that we can do to, again, to start thinking at the top of the brain, where we can have that executive functioning and that organization, really good planning, judgment, as opposed to that prehistoric brain. We've also heard, you've heard, it's a take on a similar phrase, which neurons that fire together wire together. So as we're creating new activities and practicing and getting good at something that's new, we're getting those neurons to fire, and we're actually exercising our brain. Just like we want to exercise our body, we want to exercise different parts of the brain. So coming up with different activities that engage different parts of the brain. It might be puzzles, it might be music, it might be a new language, it might be reading a map. Might be Sudoku, doing numbers, versus word search, doing words, Scrabble, things like that. So mixing it up and trying different things helps us fire different areas of the brain, which is a form of exercise. Getting organized. Sometimes when we feel that our environment is chaotic, or maybe we're disorganized with our calendar or our desk, things like that, just the simple act of getting that a little bit more organized helps you think in a more organized way. Getting help, asking for help from friends, and again, we talked about professional help too. That might be a way to help you get through and solve some of these issues. Having a positive mindset, having an attitude of gratitude, finding that purpose. So we've been nudging people to find purpose, and that is really, there are so many benefits to that. Michelle, you look like you wanted to say something.
Just what you were saying reminded me of a client this morning who's going through, it's very stressful at work. They're switching over to a whole new computer system. They're down a key staff member, and her parents' health is failing, and it's 12 hours away. Her parents live 12 hours away. So she was describing all of this stress, and what we came up with was this place where she works has a gym that's been closed through the pandemic, and they reopened it. So she's going to make an appointment for herself. Nobody has to know what her appointment is about. 3 days a week, and just go to the gym, move, get away from it all. I bet when she comes back for the rest of that day, she'll be so much more productive.
That's great.
Kind of aligned with what you were saying.
Yep. Yep. So also on ourselves, if we don't have people around us, we can find things like we talked about massaging hands. If you look at the palm of your left hand, right in the outside corner of your hand on the inside of your wrist is a pressure point for stress and anxiety. So just simply using your thumb and pressing in that area and doing some deep breathing can really help with the relaxation. Rubbing your temples gently is another way. Some people go and get acupuncture, and some people find the pressure points to do the acupressure for themselves. So there's lots of ways, and try them all. Keep trying one until you find one that really works and makes a difference for you.
Everybody will probably laugh, but I found this at Walmart, and I keep it on my desk, and I love it. But it's just this little thing that massages your head. Ah, it calms me down so quickly.
Good.
Any comments? Anything along these lines of what we've talked about that people have found that really work, especially good for them?
We do have one comment here. To exercise the brain, I do a lot of crossword and word search puzzles.
Yeah, it's good. That definitely makes you think.
Mhm.
Oh, a scary statistic. Pre-pandemic, people over 65 watched an average of 7.2 hours of television per day, 51 hours of TV per week. And post-pandemic, or during the time we were sort of under lockdown, it went up by 2 or 3 hours. So we highly discourage that. Binging Netflix is not going to keep your brain sharp. And I'm sure we all know that, but boy, it's easy to fall into that trap.
We have another comment. Wordle, I've heard of this, and here it's the biggest rage. Sure, a lot of you play that. It's an app called Wordle. I believe it's somewhat similar to Words with Friends. I think I'm probably not doing it the service it deserves, but heard many people play that. Somebody commented that de-stresses them, keeps them active. We've got a number of things here that are flying through here. Give me 1 second. Wordle, getting out to walk after a stressful meeting helps me. That's
yes,
great idea. Reading the New York Times. And
I could go either way for me.
Yeah.
Some people like to connect with nature, just getting outside, listening to wildlife. I know a friend who loves to bird watch, and that's their way of de-stressing, is just going out into the woods and just listening to nature.
I like it.
A bath with a candle. Whatever works for you. It may not work for everybody, but find what works for you and carve out time, because you're worth it. Carve out time and take time to do that for yourself.
Definitely. So
Hey, I
Ellen,
also have a,
oh, yes.
oh, I'm sorry. I was just going to say, I also got a sticker book for adults and also coloring book for adults that is, you know, just to relax myself. And I also take a brain activity class. It's 2 hours with other seniors that we play games and, you know, challenge games, you know, what's words to start with A, that whatever, you know. And that's a lot of fun for 2 hours. It's through Prince George's County, the SAGE program again.
Okay.
That's great.
A lot of the senior centers also have trivia, or they have current events, or they have debates. And so again, those are great ways to socialize and exercise the brain. Some people just like journaling.
Oh, no, I was just going to say, we also have a Ladies of Bowie club that we started 3 years ago that's active. In fact, they're at a luncheon now. I'm here, but that's okay.
Oh, thank you.
We do all sorts of stuff. So
That's a great stuff. Yeah.
We have one more that says Cornell, Merlin, and eBird. So we have a birder one here, which I love very much as well. So I'm right there with you, James. Thank you very much.
I just love these. So Ellen, what if somebody suspects that they really do have decline that we can't immediately fix?
First thing is, don't panic. A lot of people think, oh my gosh, you know, what am I going to do? I'm declining, I'm forgetting things, I'm misplacing my keys, I find my purse in the refrigerator, something's not right. And that stress and anxiety, again, remember, is going to cloud our clarity. It's going to cloud our thinking. So what we want to do is, there's no need to panic. A lot of times we need to rule out medical basis first. Mm-hmm. So we may do that by going to the primary care physician to start. And I think you can advance, primary care physician. It's going to rule out some of those medical things. So Michelle had mentioned, maybe it's thyroid, maybe it's negative interaction to some type of medication, maybe there's a vitamin deficiency, maybe there's an infection. There can be a number of different reasons why we have difficulty with clouding. So we'd start out with some, basic exam, possibly blood work, some basic test or screening. And sometimes there are some medications that maybe the primary care would recommend to help with cognition, but that's probably not going to be the first step. So maybe the primary care physician, and then maybe seeing a neurologist. So a neurologist is a specialist in the brain and the wiring. So the neurologist may do an examination. They could do an in-depth cognitive screening or cognitive assessment that might take a couple of hours, but would give a lot of information. There's some imaging like CT scans, CAT scans are really important when neurology is trying to figure out if there's some kind of cognitive issue or some type of issue wiring in the brain. Maybe a neurocognitive person or a neuropsychiatrist or neuropsychologist are also specialists who would be looking at brain issues or cognition issues. Might be somebody we tap into. An aging LifeCare manager, that is a care manager like myself who can do cognitive screenings. But once there's been a diagnosis, we can help that individual and the family create that care scenario that still allows for as much independence as possible. A lot of people start panicking and thinking, oh, I have to go to a memory care facility where I'm going to be locked in for the rest of my life. That is for somebody who is very far down the road very progressed with dementia, who is wandering, who is agitated and has really serious behavioral issues, or need that constant cueing to be able to do every step of their daily routine. And so that is for somebody who really would be at safety risk out in the community. But just because you have cognitive decline or cognitive light memory issues does not mean that's where you're going to end up. So what we want to do is be proactive, is get those medical things ruled out. Let's get the cognitive screening done so we can see what we're even working with. And let's get those supports in place so that if it progresses or as it progresses, we have that infrastructure in place that's going to help support the person. And it may be medications, it may be care managers, it may be that care team or care village that we create, people who are doing wellness visits. Might be a caregiver who just comes in a couple days a week to help you with the things that you might find difficulty doing that you used to be able to do independently.
Yeah.
Did you want to add anything, Michelle?
No, I agree that there's so many steps long before we think about a memory care facility. That was a great point.
Yep. And there's also things we can put into place in the home, like a medication reminder system, or using Post-it notes and just cueing yourself, reminding you of something you needed to do. Getting a big calendar that's easy to see and making sure we're really good about putting everything down on that. Using that calendar, creating a schedule, creating that structure, because sometimes when we're not working and we're not having that 9 to 5 kind of cueing to our day, we may start to lose that structure to our day. So the breakfast, lunch, and dinner, sleeping, trying to sleep 8 hours at nighttime instead of the daytime. Things like that help us create that structure that our jobs used to create for us, or our families used to create for us. But now that we may be living alone, or it's much quieter, we may start losing that firm structure of what our days used to be like. So these are assessments that may be used by a care manager or by a neurocognitive person who is doing screenings. And what I want to say is that a lot of people think, oh my gosh, if I do that, they're going to think I'm crazy and I'm going to be going to a facility. But what I want to say is a lot of people in their mind think that you're either normal or you have dementia. And there's this wide area in between, which is called mild cognitive impairment, or MCI. And that span could be 10 years. So it doesn't mean if you're starting to notice some things, it's probably already been working 5 to 10 years before that diagnosis. So it can be a really long time, except for some early onset ones or certain types of dementias that have a more rapid progression and start earlier in life. But the typical types of dementias that we see, we could be working on them for 5 to 10 years before we're diagnosed. And we have that years of cognitive impairment before we're considered to have dementia. And we can have pretty significant dementia and not need to be in a memory care facility. Again, it's all about understanding how they're able to function, what strategies we can put in place. And, basically we're looking the highest priority is keeping them safe. Did you want to talk about this, Michelle?
Well, just to know that dementia doesn't necessarily always mean Alzheimer's disease. There are a number of different types of dementia that come somewhat from different patterns, different reasons. And so kind of backing up, mild cognitive impairment is usually that early phase when it's something that we can't fix it with the vitamins and the testing in the heart and the lungs and the thyroid. But it's not to the point of diagnosing dementia. It's just some early signs that things have changed. At that point, there are some nutritional things, all of these brain games and brain strategies that we've talked about, all of those can be helpful. And then if it progresses to the point of dementia, then that's where more tests are going to be done to figure out which kind, and that will somewhat help figure out what the therapy and the course forward would look like.
Yeah, so I'd like to add and kind of reiterate what Michelle was saying, that dementia is an umbrella term.
Mhm.
And there are actually close to 200 versions of dementia from different etiology. How it started is from a different area of the brain or a different pathway. And that might even dictate what type of medications you're on, right, Michelle?
Oh, definitely, completely. So one of our questions for you is, when we think about this series and months ahead, is there interest in a future session that is more focused on, now you've got the diagnosis of dementia or someone you love has the diagnosis, what comes next? Because that really is a whole nother hour of information. So we're just curious, is there interest in that? Or we could move on to all sorts of other topics?
I just had a question about your past. This is the first time I heard about the wellness series. Can we get a list of topics that you, or recordings that you had in the past on the wellness series?
Yeah, this is Jeff. Hi, and thank you for participating today. Absolutely. So typically I send out a post-webinar follow-up email with some information, including a video of the session that we just had. So I'll go ahead and send out the videos for all of our previous sessions in this follow-up email this time around. So, and it's also available on our YouTube channel at Elvil and Associates. So, but I'll go ahead and send out the video of all of our sessions thus far.
Thank you.
You're welcome.
With that, we can wrap it up. If there are any last minute questions, we'd be happy to answer them.
Thank you for being so interactive. It makes this so much more fun. I really appreciate it.
So you might have one more
I
question.
mean, I do have one more question. I'm interactive. Do you all have resources available for things for seniors to do and that might be of interest, or a place we can go to?
Oh my goodness. Wow. There's a lot out there. And I think with the pandemic, especially a lot of the senior centers have created programming that is virtual. Sounds like you've got a lot down there in Bowie that you're working on. But a lot of all the counties have some virtual aspect of engagement sessions and things to do. That might be a great place to start.
Thanks.
You have another question, real briefly. What do you think of Balance of Nature, advertised to have all the fruits and vegetables you need each day in 6 capsules? Is it a waste of money, or does it really help your energy and brain health?
You know, our body was made in such a way that when it needs something, it'll absorb it. And when it doesn't, it'll just let it go. And a lot of times those shotgun approach type supplements that are going to just give you lots of everything end up mostly coming out in your urine that you don't need. So a healthy diet, I would definitely recommend before any sort of supplement. And then if you're going to supplement, maybe talk with your doctor about getting some of those. How is your vitamin D? How's your vitamin B12? Is there any sign of anemia? So that you could selectively replace things that you need and not waste your money on a bunch of things that you probably won't absorb. That's my opinion. Do you think differently, Ellen?
No, I think you're on target, and obviously wrapping in pulling in the primary care physician to have that discussion too is a great way to get more information.
Yeah. As we wrap up, our COVID project has been to take all these things that Ellen does one-on-one with people to help them kind of plan for the future, know where their resources are, strategically figure things out based on their own health picture. And then what I do, which is prior to retirement and through retirement, helping people get a really accurate picture of their current health and how to plan to sustain that. So we pulled all that together into Propel Comprehensive Wellness, which is powerful retirement options for a purpose-filled, engaged life. And if it's okay, we'll just send you some more information about that, because the whole purpose is to help people prevent that retire and decline, or those divorces that are rising, or those people that kind of fall into a despair where they lose their sense of self and there's a rising suicide rate. We don't want any of that. So if you're interested, we'd be glad to share with you more about what we've done in this monthly modules that have little videos and workbooks and things to challenge you to create a solid plan for yourself. And then this is how you reach us. So I just wanted to get all that in, Jeff, before we officially wrapped up.
Yeah, well, thank you as always, Michelle and Ellen. Really great session. I think we all got a lot out of that. And thank you to all of our attendees for participating. As I'll echo what Michelle said, it's just so helpful and enjoyable when people speak up and post their comments, and just really makes it interactive and fun and engaging. So we'll certainly keep this rolling, and I'm so glad to see it grow. We're seeing more and more people register and attend, and so we'll see where it takes us. So thank you, Michelle and Ellen, and everybody that's been here today. Just real quick, since we're up against the clock, check out Elville and Associates events calendar. We have a packed end of March and April for our webinar series. We have a lot of our traditional presentations coming up. We also have on April 12th a discussion about Medicare basics, what you need to know, downsizing and right sizing in 2022. So those are two new presentations we're going to be offering with some really outstanding guest presenters. So we're looking forward to the end of March and April and what our webinar series is going to bring. So looking forward to, I don't have my camera on. That's okay. There we go. So looking forward to seeing you all again very soon. If not on one of those, then the third Tuesday in April, when we welcome you back to our webinar series, our wellness series. So with that being said, have a great rest of the day, and thank you for being here. We'll see you all soon. Thanks again,
Thank you
Ellen
so
and
much.
Michelle.
Appreciated it. Thank you.
That's our pleasure.